Welcome. My name is Maria Colon. Welcome to Georgian University and to our Expand Your Potential with Breath and Movement. We have two wonderful experts here today that will talk to you about how to do that. We have Dr. Burns and Dr. Kumagata. I'll be introducing Dr. Burns, who will be doing the breath portion of our event. We'll also be taking questions during and after. Thank you so much for spending a few 45 minutes with us today. Have a great time. Dr. Burns?
Thank you, Maria. Let me just share my presentation here, and we'll go ahead and get started on the breathing discussion. All right. So the topic I wanted to cover with everybody today is how to breathe to reduce stress. And I wanted to give everybody a little bit of a rundown of some of the important concepts of that, starting with the physiology of that, of breathing, the importance of breathing to the body. I wanted to talk to everybody a little bit about some of the stress response and what it does to the body, and then how we can use breathing and interventions with breathing in order for us to address stress in our bodies. And so I wanted to start off with physiology of breathing here. And I want to talk a little bit about oxygen here, oxygen and the importance of oxygen in the tissues to the body. The main purpose of oxygen is going to be to produce energy within the body. And we're talking about energy in the form of ATP, adenosine triphosphate. Oxygen is going to be a necessity for us to create energy more efficiently. So there's really two major processes that we're talking about when we're looking at oxygen involvement in energy production. There is an anaerobic type of energy production, which we call glycolysis. And then there's an aerobic type, which is going to require oxygen that happens within the mitochondria that takes place during the Krebs cycle. So glycolysis is a function that doesn't require oxygen, but it's very inefficient, meaning that if I were to take a glucose molecule and try to create energy from that, I'm really only going to get a net gain of two ATPs from that one glucose molecule. And that's just not really beneficial to the body overall to be that inefficient. And so the Krebs cycle and the presence of oxygen within the mitochondria allows us to instead be more efficient in the fact that we're going to take that same glucose molecule, and then we're, instead of creating two gains of ATP, we're going to actually create somewhere between 32 and 36 ATPs from that glucose molecule. So it's a much more efficient, much more beneficial process for us to undergo. That's why oxygen is going to be really important to the tissues themselves within the body. Gas exchange is going to take place in two areas as a result of this. First off, it's going to be within the lungs themselves. The lungs are going to exchange oxygen as we breathe in and inspire it into the blood, and it's going to bind to the hemoglobin within the blood itself. And then the carbon dioxide that's bound to the hemoglobin originally is going to be released in exchange for oxygen. So we have gas exchange at that one location there first. And then the second level of that is as we get the blood pumping to the tissues of the body, to the muscles, to the cells within the body, gas exchange is again going to take place. And in this time, we're going to send the oxygen outside of the hemoglobin into the tissues themselves. And the carbon dioxide is going to come in and bind to the hemoglobin for it to go transported right back to the lungs and be released from the body. And this is an important cycle, because this cycle back and forth is going to regulate certain functions within the body. First off, blood pH level is going to be regulated by this. pH has to deal with hydrogen itself, and that hydrogen is based on the amount of CO2 that's going to be in the blood. So the more CO2 that's in the blood, the more acidic the blood is. The less CO2, the more alkaline the blood is going to be. Likewise, our body's transition and maintenance of keeping and reabsorbing electrolytes within the body, or releasing those electrolytes within the body, is going to be based off of this same breathing exchange of gases that we're looking at. And the amount of CO2 is going to become so important in our body that we're going to have chemoreceptors within our blood vessels that are going to actually determine how we need to regulate breathing, if we need to breathe more or if we need to breathe less. And that's going to be determined based on the amount of CO2 that's within the blood itself, and so how much transport within the blood. And that's going to be an important concept as we go on through this. During a stress response, and what stress does to our body is it releases one or a couple of pathways. Everyone is pretty much familiar with adrenaline as one of those pathways, that fight or flight response that we're going to talk about. But the other pathway, in the presence of more chronic stress, we usually are regulating a hormone called cortisol that also is still preparing us for this type of response. Cortisol doesn't necessarily create as acute of a response as we get when we get a stress response from adrenaline, but it's still going to have the same kind of effects on the body, just to a lesser degree. And so first off, we're going to see changes in our heart. So our blood pressure is going to go up. The volume of blood that's pumped by the heart is going to go up. The heart rate itself is going to go up during a stress response. Our breathing rate is going to have to adapt based off of the necessity of gas exchange again. So breathing is going to increase. The depth of breathing is going to increase, so you're going to breathe deeper as you inhale, and the depth of exhalation decreases a little bit. And that's going to be important because we're going to talk more about that when we talk about overbreathing. Blood sugar level is also going to be elevated during stress. Your body needs that glucose to be able to produce more ATP and energy, so that if you had to run from a bear, for instance, then you were able to continuously do that. Or if you had to fight back in the case of being attacked by a predator or something to that effect. The blood sugar needs to be elevated so you can produce more energy from it. As a result of that, we need to secrete more insulin from the pancreas. We need to dilate the blood vessels to move more blood into the muscles themselves. And some of our systems are going to be negatively affected because systems that are less important for that fight or flight scenario end up having to be suppressed instead. So things like our immune system are going to be suppressed, and our digestive and reproductive systems are going to be suppressed during a stress response. And so in an acute situation, this isn't as big of a deal once you have gotten past that scenario that's caused you to go into this kind of fight or flight mode. But during chronic stress, over suppression of the immune system, digestive function, reproduction function can have drastic effects on the body. And so we want to have ways to combat stress to be able to deal with it. When we look at heart rate and stress, and heart rate in the stress response, one of the ways they do this is by looking at the variability of the heart rate. And based off of that variability of the heart rate, we can determine how much breath can affect our heart rates themselves and our stress response based off of that. So when we're looking at the way that breathing affects heart rate, what we're looking for is what we call resonance breaths or resonance breathing. And this is the amount of breathing or the rate of breathing one has to have in order to have an effect on their heart rate. And in this case, we're talking about lowering our heart rates during a stress response. And so everybody's kind of looking to find this resonance breath and to determine how much of these breathing type of exercise or how long and what rate we should use this resonance breathing in order to lower our heart rate and reduce our stress. Our body is going to adjust, again, our breathing based off the information it gets from chemical receptors in the circulatory system. And that major chemical, again, is CO2. When we look at overbreathing, what we're looking at here is the breathing pattern, again, that we saw during the stress response. The increased inhalation, faster rate, lower and decreased exhalation portion of it. Overbreathing is, by definition, this mismatch in the rate or the depth of which somebody is breathing. And that mismatch is going to have an effect on our CO2 levels, which is going to tell our brains, again, that something is wrong, and we end up even further encouraging kind of that anxiety or stress response that happens when we overbreathe. That CO2 level, again, being that important chemoreceptor marker that is telling our brain that it needs to how to regulate the breath itself. So that deep, rapid, little exhalation ends up being problematic because we build, or what we end up with not enough CO2 in our blood, which is going to tell our brains that we need to breathe even faster. And in this case, we're in a deep breathing, but it's not the appropriate deep breathing. A lot of what people hear when they are told that they need to undergo some type of breathing exercise for stress response or whatnot is that they need to practice deep breathing. That's really not enough information for people, because you can actually exacerbate the problem by breathing deeper and not breathing properly. And so what I wanted to teach you guys today is how to breathe properly instead of just kind of furthering that overbreathing that we see as a pattern of stress. Overbreathing, again, is just a term that we use in clinical settings for hyperventilation. And most people are familiar with what hyperventilation is, and that hyperventilating breath pattern, where you have that kind of really fast, deep breath and very fast and cut off exhalation. It kind of goes that type of hyperventilation that we're looking at. Again, usually caused by an acute stress response. Some type of intense exercise can cause us to hyperventilate as well. Intense emotions have an effect on this, as well as anxiety, and even a fever can have this effect. And so this is that stressful breathing pattern that we want to avoid. Some symptoms of overbreathing. If somebody is overbreathing, they may experience shortness of breath. They may experience constriction of the bronchioles, which means that it feels harder to breathe in, and they get what we call air hunger, meaning that it feels like they need to breathe more. As bronchioles constrict, we get less air into the lungs, and that's problematic then. Chest tightness, pressure, and pain can be associated with overbreathing, as can numbness or tingling in the arms and the legs, even the inability to kind of hold a steady hand, and so you end up with a trembling motion that we'll often see with that. If anybody has experienced this, then they would be familiar with these kinds of symptoms. Muscle tension ends up being very common. Muscles become tight, very difficult to relax the musculature during these types of breathing episodes. Blurred vision and dried mouth tend to be really common. And then on top of that, we can easily get dizziness. We can start to get difficulty to concentrate on tasks. What we call fogginess or brain fog or difficulty concentrating becomes a very common symptom of overbreathing. Nausea, sometimes feeling sick to our stomach, very common within this, and then sweating and shivering as that stress response is kind of going on. Sweating is usually upregulated during stress as our body needs to cool during the increased use of energy and the increased physical activity of fight or flight. Elevated heart rate is very common, and then palpitations. And palpitations are really where you're kind of aware of your heart beating. It sometimes feels like it's pounding within your chest, etc. And that awareness of the heartbeat we call palpitations, and that's a very common symptom of overbreathing as well. All right, some less common but also possible symptoms of overbreathing here. Headache, gas and bloating, and feeling gassy or bloated, sweating again, twitching. It's that musculature that's really tight and toned, and it's unable to really kind of maintain that steady, relaxed environment. Blurred vision and tunnel vision can be very common or possible. Difficulty with memory again, and then the last one, syncope, or what we call fainting episodes. That's another possible symptom here. When we are doing this in a laboratory, we usually measure this by capnometry, which is a measurement of the amount of CO2 that you exhale. But we don't always have that available to us. And so what I wanted to teach you guys is a way of seeing if you're overbreathing based off the amount of time that you're breathing per minute. The amount of times per minute that you're breathing should correlate somewhat to overbreathing or not overbreathing. And so breathing, for the most part, in a healthy individual is somewhere around 12 cycles per minute or less. Overbreathing tends to be about 13 to 20 cycles per minute, or even more. You may see 21, 22, etc. The way we measure cycles per minute in breathing for the most part, is we're looking at the expansion of our bellies or the expansion or rise of our chest as we breathe, and we're counting the number of times we do that in about 30 seconds. I usually have patients get a timer or a stopwatch and press the button to start counting the amount of times they inhale during that period of time, and then at the end of 30 seconds you want to multiply that number by 2 and you get total cycles per minute that way. Other things that we want to look for is irregular breathing patterns. We may start to hold our breath, which may be difficult for measuring things. It's that kind of, we exhale, stop, and then inhale again. And that may affect our breathing pattern as well. And the rate may not be as elevated, but we're still having problems with overbreathing in these cases. Exhalation to inhalation time, we should be exhaling longer than we're inhaling during normal breathing. And we're going to cover that again in the next couple slides. Deep breathing, we want deep, but fast breathing is the problem in this case. So we want deeper, slow breaths. And then we want to look for variables within the breathing pattern, such as slower breaths, rapid breaths, and etc. Those type of things may be indicative of overbreathing for us. So how do we breathe properly? The first thing I want to teach you guys, and what we're going to practice here in just a minute, is mindful awareness of our breath. And this can help us to be able to be aware of our emotions surrounding our breathing patterns and be aware of the pattern itself or the thought patterns that might be associated with this breathing. Next, I want to talk a little bit about posture in this case, and the proper posture being essential to proper breathing. First off, in posture, we want to make sure that our shoulders are back so that our lungs are able to expand fully, so that our stomach isn't going to be contracted and prevent our diaphragm from contracting during inhalation. We want our head to be neutral. Oftentimes when we are, and I'm guilty of this just as much as anybody, when we're at our office, when we're at work, when we're at home, we end up leaning our heads forward and we have what we call forward head carriage, and that ends up being problematic. It can really shorten the muscles on the front of the body, tighten the muscles in the back, and can lead to things like headaches. It can lead to difficulty breathing, and it can increase your stress response. So proper posture during breathing exercises is going to be extremely important. Next, we want to take low and slow diaphragmatic breaths. And that means that I want you to practice in this case when we go through this to breathe in through your nose and breathe out through your mouth as you breathe, and make sure that your stomach has the opportunity to expand during inhalation and to kind of push in during exhalation there. Pay attention to your exhalation. It should be long and it should be complete. We don't want to focus on the depth of inhalation. We want to focus on the time of exhalation during breathing. And what we're really looking for is a ratio of about 40 to 60. So 40% of our breath should be inhaling and 60% of our breath should be exhaling in that part. What I'll usually have people do, and you guys will see this in the breathing exercise that we do here, I'll usually have people inspire and count to 4 and then continue to count in their mind to 10 all the way during exhalation. And that way you can really kind of get that breath proportions proper. Count while breathing with inhalation, slow taking 4, and then exhaling slow taking 6 again. Posture again is extremely important, and the reason I have some extra slides in here is because I really want you guys to see the importance of that. Poor posture is just going to make it harder to breathe. If we're leaning forward, if we're contracting our abdomen as we're leaning forward and putting pressure on that abdomen, we're really blocking the diaphragm from being able to do its job and to expand the abdomen so that the lungs can expand fully in the chest, allowing you to take a full inhalation. Poor shoulder posture is also going to result in that forward head carriage. We want to make sure we roll our shoulders back, and we want to maintain neutral head posture as we're doing our breath practice. We want to reduce and use the use of the deep neck flexors, the sternocleidomastoid muscle, which really runs right here in here is one of the tighter muscles that we find in patients. Pectoralis musculature up here, which gets contracted because it's constantly short and it's constantly activated. And then we want to reduce the activity of those muscles. Those shortened muscles become very hypertonic. They're much more prone to spasm or pain. And this can result in, like I said, tension, headaches, and tight musculature and pain, tightness in the shoulders, etc. So we really want to kind of be aware of that posture. And science really backs that up. I included a journal article here from 2016, and the ending portion of this, or conclusion of this article, was that the results of the study indicate that forward head posture reduces the vital capacity of the lungs, and possibly because of weakness or disharmony of the accessory respiratory muscles. So the muscles that we're looking at there, not just the diaphragm itself, but the intercostal muscles between the ribs that allow us to lift our rib cage and expand our lung capacity are inhibited as well for bad posture. And that study was excellent at pointing that out. So next, what I wanted to do here is to, I'm going to stop sharing and I'm going to take you guys through an exercise here on breathing. So what I'd like for you guys to do is to just follow as I repeat or as I mention what the instructions are. Try to be comfortable as you get started and try to find a place that you can just sit and relax as we do this. So I'm going to have you guys begin by being comfortable in a seated position if possible. Try to roll your shoulders back. Try to maintain a neutral head position and to close your eyes and concentrate on the sensations that you're going to be feeling. As your body begins to interact with its surroundings, become aware of things like the air against your skin. It may feel cooling if you're inside in the air conditioning, or maybe it's warming if you're outside in the sunlight. Take a deep breath without forcing yourself to inhale beyond what's comfortable. On the next breath, inhale through your nose while counting the time it takes to inspire. Bring all of your attention to your breath itself. Feel the air move into your nose, cooling the skin as it passes. Feel it travel down into your lungs, expanding the lung tissue as your diaphragm contracts, pulling downward, further expanding your lungs. Be aware of each breath of your body. The muscles on your ribs contract on inspiration, the expansion of your abdomen as your lungs begin to expand. Be aware of each inspiration in the breathing cycle. Don't try to change anything about your breath, just become aware. Observe your body's movement as you start to accept the movement patterns of your body. It's really important to not be judgmental on whether you're doing this exercise properly or not, but to just become aware of your breath and of your movement patterns themselves. Breathe gently inward and outward as we feel the air enter and exit our bodies. Take a moment to practice this. Now let's try to expand our awareness. Let's include the expiration portion of the breath. We want to expire the air through our mouths themselves. We want to inhale through our nose and exhale through our mouth. Become aware of the sensation of this. As you breathe, become aware of it cooling our noses and the warm breath exhaling as it passes our tongue and our lips. Breathe in again. 1, 2, 3, 4, and exhale. 1, 2, 3, 4, 5, and 6. Continue to count to yourself on the next 4 breaths. You may notice your mind begin to wander as you do this, and that's okay. It's normal for our thoughts to wander a little bit. Become aware of your thoughts and accept these without judgment of ourselves. And we'll try to refocus your mind on your breath. If the same thought keeps occurring, then address this thought in an accepting way and realize that through observing these thoughts, we're able to grow and to learn better. The knowledge allows us to better understand and accept ourselves, reducing our stress and enhancing our relaxation. And try to bring your attention back to your breath. Once again, being aware of your sensations. Feel your belly expand as you breathe in and feel the tension release from your body as you breathe out. If you feel pain or discomfort, strong emotions, or anything else that distracts you from your breathing, then be aware of it, accept it, observe it, and try to refocus on your breath. We're going to focus ourselves once again on our whole body. Become aware of your body's contact with the chair. Become aware once again of your feet making contact with the floor. We're becoming aware once again of our neutral head position, of our shoulders as we keep them in the proper posture and roll them back. We're going to take a few more deep breaths. When you're comfortable, open your eyes and allow the light of the room inside once again. Allow yourself to become more alert and awake, but maintaining the calm that we feel during our breath. Your breathing is always there as a center of focus when you need it. So use this. Use this practice to help you deal with the stress and to help you relax when you feel the need to focus yourself once again. Breath awareness exercises can be a very useful tool for focusing our intentions first thing in the morning or helping us to relax at night before we go to sleep. Try to do this a little bit each day, just a couple of minutes, to try to get good results. Thank you.
Thank you, Dr. Burns. We have a couple of questions for you. One is, this person says they're very guilty of the bad posture, especially while sitting at their desk and being at home right now. Any tips on how to help the posture?
The big thing is making yourself aware of the bad posture when it happens, and that can be really hard to figure out. So one of the tips that we used to do is to have somebody to kind of place some type of a piece of tape or something to their back. You can actually put it right between the shoulder blades on the back. Athletic tape works really well, and every time you kind of round your shoulders, it'll stretch that tape and make you more aware of your posture loosening, and that'll help you to correct it. After you correct yourself regularly for a few days in a row, it becomes more natural to sit in a proper posture position.
Excellent. We have one more question for you, Dr. Burns, about the breathing exercise. Is it something that you can do every day or just when you're stressed?
You can do this every day, and you can do this to help set your intentions for the day, or even visualize yourself throughout the day and try to use this type of visualization to help yourself reduce the likelihood of stress. And this exercise can be, like I said at the end of that, very good at setting those intentions or very good at helping you relax before you go to sleep at night as well.
Okay. So now we have Dr. Komagata, who is going to do the movement part of our presentation. Dr. Komagata.
Hello, everyone. Can everyone hear me? I'm going to put a few slides and then moving into the movement section of the day. First off, welcome everybody, and it was so nice to hear Dr. Joshua Burns talk about the importance of proper breathing. And this section is about health benefits of movement. I am certain most of you either listening to this live or recorded already appreciate the benefit of being physically active, I'm sure. This is just to reiterate and re-emphasize that benefit, the various benefit. By moving regularly, you can control your weight and prevent obesity, reduce risk of heart diseases and some cancers, help your body manage blood pressure, blood pressure and insulin levels. If that's the case that you want to manage, you need to move regularly and every day. Movement also helps you quit smoking, improve your mental health and mood, help keep your cognitive skills sharp as you age, strengthen your bones and muscles. If you are lucky and young enough, up until the age of 30-ish, you are still continuing to build your bone density to your maximum level. So anticipating after that, you may slightly lose some of your bone density. That it is best to keep your bone density to the maximum as much as you can by being physically active. Moving also help keep reduce your risk of falls in terms of balance, improves your sleep, improve your sexual health, and increase your chances of living longer. And not just living longer, living healthy living. So if we have a medicine or a pill that put exercise and physical activity into a pill, that's going to be a not $1 million, it's a $1 trillion investment. So why Tai Chi? Well, today I was thinking about showing you some Tai Chi movement, and actually you don't have to do Tai Chi. There are millions of other ways to move your physical body. And then but I focus on Tai Chi today, and because Tai Chi is a low impact activity, it's not bouncing and pounding your body. So it's gentle to your weight bearing joints. Even if you have arthritis in the weight bearing joints such as hips and knees, you are most likely be able to do Tai Chi relatively comfortably. Tai Chi movement is adjustable, meaning that if someone is very fit, you can make your Tai Chi movement even more physically demanding. For instance, if you are bending your knees, you can bend further to make your squatting deeper if you are fit. If you are not fit and you are just starting the movement, you can do it just as if like you are standing regularly. The movement in general is very slow. So by doing slow movement, you actually become, you need to be more aware. You need to pay attention to what you are doing. It enhances your awareness of qi in Chinese, qi in Japanese. It's a description of life force or energy that permeates our body and move and animate ourselves. And through Tai Chi movement or Qigong, you may hear that you become more aware of energy within and outside of your body. As Dr. Burns mentioned about mindful breath exercise, Tai Chi can be a mindful movement and mindful and meditative movement. And finally, Tai Chi can be performed at any advanced age. I think that those are the reasons I decided to show Tai Chi today. Whether if you have any physical limitations or not, whether if you have ever tried Tai Chi, I hope you will be open-minded to try this out with me today. And the references in terms of what it is I'm going to show you today is coming from Tai Chi for Health Institute, and that institute is led by Dr. Paul Lam in Australia. He's a medical doctor, and when he lost his health due to malnutrition when he was growing up in China, and by the time he became a medical doctor in Australia, he says that he couldn't even hold his medical bag because his joints are deteriorating so badly that he couldn't carry the bag. I'm sure that was in his 20s. And he thought about what he can do, and what he found was to try out Tai Chi. And he practiced and learned Tai Chi, and eventually he overcame that structural damages he already had in his joints, and he's able to live his life fully. I'm sure he's in his 60s or 70s by now, and still he indicates that he moves much younger now than when he was in 20s because of that. So if you have questions about the movement I'm going to show you today, you can go to Tai Chi for Health Institute, and that's where you can find some of the information. And here is the reference I use for today's session. So I hope you're ready. I'm going to close this slide, and I will show you my movement now. Okay, so I hope you can see me. I'm going to stand up and step back, and I'm gonna keep talking because that's what I need to do to keep the camera on as a presenter. So excuse me for talking while we are moving. First set of movements are to move each joint from the neck, shoulders, trunk, hips, knees, and ankles. Two movements each. So you can stand up nice and comfortable, your knees slightly bent, not hyper extended, just slightly bent. And you're going to start out with just giving that breath Dr. Burns provided today. You can breathe in from the nose, go right ahead, and breathe in so that you are going to utilize the diaphragm, the muscles that divide your thorax, your chest cavity from the abdominal cavity. That's a huge dome-shaped muscle. So let's use that muscle by breathing in. When you breathe in, your tummy goes out. And when you go breathe out, the tummy goes in. You will do this a few times. And then gently and slowly move your hands in front of your body. Together, palms down. Turn your palms to your face. Slowly bring your hands closer to your neck. When you do so, gently, slightly, you do a neck and chin tuck. Straighten your neck and pushing out with your two hands forward. Bring hands down. As you do so, you can look down. So you're basically moving your neck, bending your neck forward. Same movement. Bring your hands up to the shoulder height. If that's not comfortable, you can keep it lower. Turn your palms to yourself. Bring your hands to your neck. And gently pushing your neck to do a chin tuck. Bring your hands forward. And same, going down and your neck bending forward. Let's do one more time. Turn your palms towards you. Bring your hands chin tuck, and push your hands forward and down. This is the last one. Bring your hands up again, same exact way. This time you're going to turn your right hand facing you as if you have a mirror, hand mirror. So look at your hand, examine. You can look at the palm or you can look at the tip of your fingers. Just keep your gaze on your right hand as you lower your left hand down to the side of the body. You're going to bring your right hand to your right side. See what you're doing? You are looking at the hand. Hand is leading your neck movement. You are turning your neck to the right. You will do the same on the left side. Looking at the left hand, right hand goes down to the side of your body as you turn your neck to the left. You will do this 2 more times, both sides. Every time you do, try to go a little bit further out to the side, but not pushing. Know your limit and just do what you can do. Looking at the left hand, the hand to your left. And one last set. Some of you recognize I am doing this. Every time the hand goes out, there's a point. Both hands are almost touching each other. To your right. And to your left. Next one. I hope you are able to move your neck freely without pain. So bring your hands down, moving into shoulders. You're going to rotate your shoulders first 3 times forward, gentle. And then backward. This time you can open your hands out to the side as if you are gathering the energy and pushing that down. You can bend your knees if you're comfortable. So for those who are very fit, you can go really deep squatting. For those who never squatted, just gentle bending of the knees, fine. One more time. And then the trunk. Let's do the kind of separating heaven and earth movement. So you're gathering your energy. One hand, whichever you decide to do, one hand goes in front of your face, covering the face with the back of your hand. The other hand goes downward, while this hand keeps moving toward the heaven. Separating. Palms facing each other. And bring these hands together. This time you can bend your knees if you like. Now the other hand goes up. See the face is covered with the palm back of the hand. And then goes to the opposite direction. If you like, you can bend your knees this way. When the palms are getting closer, bend your knees. And then when you're separating, you can be on your toes if you like. It's up to you. And bend your knees. Palms together. The hand goes up. It's going to be covering the face with the back of the hand. Spreading out. And we may have done 3 times already, but since I lost count, I'm gonna finish up with this particular set. Here, this is the last one. And ending. Okay. So you are bringing the arms in front of your body again, in front of you. And suppose you have a little ball, beach ball between your hands. But this time, let's make that ball a little bit bigger. So large beach ball. And this time, you're going to turn this beach ball. So one hand goes up, one hand goes the bottom of the beach ball. Let's move your trunk to the hand is above. So go to that side and recognize that your trunk is twisted. Again, you're going to turn the ball. So the other hand is going to be the top. And then let's move the ball to the center and to the left, in my left. Turn the ball. And you can make this trunk movement with hips and ankles and knees as well. But make sure your trunk is twisted. That's what this movement is for. Moving to the other side. Rotating the big beach ball, the right hand at the top, and moving to the right. Turning. This is the last one. Okay, so here is a little ball, and you can finish that. Okay, so next one is a hip movement. I'm going to ask you to lean towards your right foot as you raise your hands in front of your body, just like you have been doing. What's going to happen is next you're going to swing your hands backwards gently and slowly as you advance your left foot forward with heel touch on the ground. So bring your hands down and back. You're putting the heel touch in front of your body. I wonder if it's easier to show you sideways, but let's see. Do it again, bring your hands back. The foot goes forward with the heel touch, the toe touch in the back. Heel touch in front, and toe touch in the back. And switching. So leaning towards your left, bring your arms up, bring your hands back as you bring the other foot forward. Heel touch, toe touch. Heel, toe, heel, toe. One last set, front and back, and then up here. Another hip movement is bring your hands out in front. One hand is pushing the wall on the side. Another hand is almost touching the elbow or between the around the forearm, so below the forearm. So as you push the ball to one side, you're going to touch or extend your foot on the other side. If you can see me doing that. Switching the side, hold the ball, and extending the other foot out. So you would repeat this. The leg goes to the opposite side. Let's try one more time. Okay, good. Now, a little bit of kicking. You're going to have a fist and have your feet slightly apart, spread apart. Your hands at the hip, bend your knees. And if you are comfortable, you're going to shift your body weight one way, and you will do a gentle, gentle kick in front of your body. If that's not comfortable for your body, you can just do point your toes on the ground. So if you're comfortable, lean to the one side, gentle kick with punching with the other hand. Leaning, kick, and punch with the other foot, other hand. Kick and punch. Kick and the other punch. Kick. And this may require some balance as we do it very slowly, not quickly. Okay. So exactly the same kind of idea, same fists on the side of your hip. Lean onto one side. Step out with heel and toe as you punch into the front. Switching, punching. Make sure you are stepping and shifting your body weight to one foot to the next. That's pretty much the key here. Stepping, shifting your body weight from right to left. And one last set. Okay. How is your breathing? How is everything? Wow, time just passed. So I just realized it takes a lot of time to just go through this. You can put your hands at the bottom, lower abdomen. And this is another center, energy center of the body. So you basically lean to one side, heel, toe, just touch heel and toe in front. Let's just do 3 times. Heel, toe, heel, toe, heel, toe. Okay, so these are the kind of warm-up throughout the body from the neck, shoulders, trunk, hips, knees, and ankles. And I guess finally, before I finish my part of the movement, I would like to show you very simple few movements. So one is the having your hands in front of your body, just about your face, the width of the face. And as you do the breathing in to expand and breathe out to shrink. And you can imagine opening and closing between your width of the face to the shoulder width. And then bring your hands down. Okay, so there are a lot of more movement. I'd love to introduce you, but I am going to stop here for the sake of the session and time.
Thank you, Dr. Kumagata. We have a couple of questions for you. So one student asked, they have difficulty with their knees. So they were wondering if the Tai Chi or the Qigong can be done while sitting. Are there accommodations for that?
Yeah, excellent question. Thank you for such a great question. So Tai Chi and Qigong, you can do in sitting. And what you may have to do is imagine the movement, even though you are not kicking the leg in the air, you are sitting and imagining that intention, that movement. And that's all you need to do. So yes, accommodation
Great. And then we had another question.
is absolutely, yeah. important.
And they had another question from a student. They were wondering, they're sitting more at home because everyone pretty much is working from home. Are there sort of desk exercises that one can do? I know it's not Tai Chi, but do you suggest like she
Yeah,
could
there are
stop every couple of minutes and do something?
absolutely. Yeah, there are so many ways you can do, and I'm hoping I can share some
Maybe for
resources later.
maybe
But
for a
simply
future.
put, 30 minutes punching. Yeah, you can do like set a timer and 30 minutes punching. That's like one of the things we do in meetings. Like, I mean, standing up isn't better, but if you don't stand up, punching in the air, and you can do, hopscotch sitting. You can imagine spots on the ground, and you move from one spot to the next. And sometimes you use like a clock, 1 o'clock, 2 o'clock, 3 o'clock, and then you move your foot from one to the other.
Great suggestion. I have a couple questions for you, Dr. Burns. So, because everyone knows the pandemic, they're wondering, is there a better way to breathe when they're wearing a mask?
As far as wearing the mask is concerned, you can still practice the same breathing exercises. The changes to the mask itself shouldn't push too much of a difference with the inhalation and exhalation. I know it can be a little bit harder, and maybe the breathing exercises themselves are better practiced alone in an area that you can kind of relax and not have to focus on that or not have to social distance. But if you're in your office and you have to do that, then utilizing it with the mask shouldn't make too big of a difference. I would just kind of keep it slow, keep it kind of pushing the breath in and out in a relatively relaxed manner, and not really forcing things. Otherwise, it shouldn't have too much of an impact.
A proper way to breathe when they're wearing a mask?
I'm sorry, I missed the first part of it. Can you repeat it?
Is there a proper way to breathe when they're wearing a mask?
Yeah, and this one can be hard because it gets difficult sometimes, where it feels difficult to breathe while you're wearing the mask. Ideally, the mask shouldn't impair the mechanism for breathing. You should be able to breathe the same way. And ideally, again, it's going to be focusing on posture, making sure that you're standing or sitting back with those shoulders rolled back. Try to keep your head from being forward tilted so you're not impeding anything anymore. Make sure you have open room for your abdomen to expand, and then kind of just inhale that deep breath slowly and exhale slowly as you're wearing the mask, just like you would without it.
Thank you. Dr. Kumagata, do you have any last words for our?
Okay, so just adding the mask thing, that there are many different types and shapes of the masks, so that I hope people try out slightly different design. Sometimes some styles are easier for you to breathe than others, even though the material is the same. So I hope you try it out and what works best for you.
Thank you so much. Thank
and
you
that
so
may be
much.
additional comment about that.
Thank you so much, Dr. Kumagata and Dr. Burns, for bringing this wellness to our interested students. We will be sending everyone the video so that they can review and do this at their leisure, and we'll post it also on the website. Thank you so much. Enjoy your day. Stay well, stay safe. Do your breathing techniques and move your body. Thank you.
Thank you, everyone.
Thank you. Bye.